Good morning, good afternoon, or good evening. Today we're going to talk about a super boy from Brazil. This 2-year-and-a-half-old patient, with a severe disease, fighting for his life. He was diagnosed with metachromatic leukodystrophy. It's a severe condition which he loses his brain, he loses his the neuromuscular plate that is not working anymore. He could not even sustain his head over his neck, and not even the trunk instability. Was not eating properly, losing weight, losing muscles. Family in despair, totally despair. And so he came, but still we see the family and the boy himself saying that, well, let's do it. And we did. We prepared the body. As I told you, we always have to prepare the body, because a patient coming with a disease like cancer or a degenerative disease, they are never coming here in a good condition, health condition. It's really, really bad. And so we do have to increase this body capacity to supply and to support the stem cells that will do the job. And in his case, yes, it was difficult for the family and it was difficult for the patient. Despite being a 2.5-year-old boy, and he knew exactly what we were doing, and injections and IV solutions, and even hospital for intrathecal injections using a specific kind of stem cells, the bone marrow derived stem cells with ectodermal lineages to supply mainly the brain, the neurons, and mesodermal for the muscles, and Muse cells that we're going to talk a little later about the Muse cells. And so this patient in particular, he stayed here with his family for almost 3 weeks. And when he arrived here, he was not eating, he was not sitting, he was only crying. He came from Brazil, crying in the airplane, crying meanwhile he was here with the parents. And the next day after the first protocol, and the protocol was not about stem cells, the protocol was about to stabilize a little bit his health condition and improve his health condition. And the next day he was sleeping, he was eating, and now we know the late notices we have from him is that he is going to school. Talking about stem cells specific in this case, it's a degenerative condition, and this degenerative condition, of course, they have to go first to some neuros just to check what is happening, just to make the diagnosis. And usually they are not coming here for the first time. But when they're coming here, is that maybe the doctor, they said, well, there is nothing we can do, because in Brazil usually they don't use stem cells. So there is nothing we can do. And so what the unique thing you can do is just to give this medicine just to control better the spasm, muscles spasm, and that's it. And now we see that a 2-year-and-a-half-year-old boy is back to the school. This is amazing. Not amazing for the stem cells alone, but it's amazing because before the stem cells, he had his body prepared for the stem cells. They are doing a good job. And next opportunity, we're going to talk about some patients also with some other severe disease or even about cancer. Thank you very much.